You're watching ABC4 News.
Whether you're a woman or care about the women in your life, it's a topic that impacts everyone. October is Breast Cancer Awareness Month, and today it is the topic of our Healthy Choices segment. Cindy Christensen, American Cancer Society Senior Manager of Community Development, joining us now to talk about what all of us need to know about breast cancer. Thanks so much for joining us. Let's first talk about the state of Utah. How many women in our state will be diagnosed with breast cancer this year?
Well, we know that nearly 1,800 women in the state of Utah are going to be diagnosed with breast cancer, and about 300 of those women will die here in the state of Utah. So it's definitely something, it's the second highest cancer diagnosis for women in the state of Utah after skin cancer. So about 1 in 8 women will be diagnosed with breast cancer in their lifetime.
So we all know someone, and we hope it's not us, but it's something we need to be aware of. So what can all of us be aware of, and what can we do to reduce our risk of breast cancer?
I mean, there's definitely things you can do to reduce your risk of breast cancer. Limiting alcohol, healthy eating, active lifestyle, all those things are things that can help. But we know the number one cause of breast cancer is being a woman and getting older. We can't 100% prevent breast cancer, and that's why it's so important that women are getting screened and finding it early.
Let's talk about the symptoms of breast cancer, the screening, and kind of what we can do to be proactive. Because as you said, we're all going to get older, so the chances of this, unfortunately, are a reality, but we can be proactive to catch it early.
Exactly. And you know, women, you're the best advocate for yourself. You know your body the most, so make sure you're doing your checks, that you're going in and getting your recommended screenings, but that also you're paying attention to any changes that might happen in your body. You are the best chance you have of catching something earlier before you start your regular screenings.
So just be aware and ask questions. Don't be afraid to bring something up if it's something that you want to have answered. What are the American Cancer Society's screening guidelines for breast cancer?
So women should have access to mammography starting at 40 if they're at average risk, but definitely by the age of 45 to 55, you should be getting those screening annually and biannually after that. If you're of more advanced risk, like you're more likely to get breast cancer due to family history or genetics, you need to be talking to your doctor about what those early screening options are and how you can access those.
Unfortunately, here in the state of Utah, we're not very good at getting those checks. That's just a reminder to everyone. You need to make that happen. Let's talk about the programs and resources that the American Cancer Society has available for women looking for breast cancer information, for resources. You really have so many things at people's disposal right there in one spot.
Yeah, I mean, the American Cancer Society is at your fingertips 24 hours a day, whether you call our 1-800 number for information at 1-800-227-2345 or cancer.org. Those are great resources for information. If you're diagnosed with breast cancer, we have a great support program called Reach to Recovery, where you'll be actually paired with someone who has a similar breast cancer or similar cancer story to yours to help you through your journey. And we also have access to things like wigs, prosthetics, head coverings, all of that through our Tender Loving Care program that you can access through cancer.org as well.
We hope that no one is given this diagnosis, but if they are, you definitely are a place with so much help and resources and comfort for someone dealing with such a horrible situation. Let's remind everybody once again to go get screened and go get checked to find out as soon as possible if they do have a problem.
Yep. That's all we ask, is make sure that you're talking to your doctor and getting the right screenings at the times that you need.
Okay, thank you so much for joining us. Such an important topic, and we really appreciate you being here today. Of course, all that information is waiting for you online at abc4.com. Thank you very much.
Thank you.
Coming